Welcome, everybody. My name is Ryan Donovan. I'm the director at the Southborough Library. I want to thank everybody for coming tonight. And you didn't come here to hear me. So I'm going to let Dr. Alker take it in just 1 minute. I just wanted to let everybody know we're recording the program tonight for the library's YouTube channel. All right, Dr. Alker.
Thank you, Ryan. Hi, everybody. Thank you for coming. I'm going to just introduce myself, and then I have sort of a 12-minute video that we'll share, and then we'll have a little bit of time afterwards to ask any questions, and I'll show you some resources on ways to learn more, get more information, and get involved in the topic. So I like this topic, and just as background, I'm the new public health director. I've been here at Southborough for about a year. And before that, way back when, I practiced OB/GYN. That was my first specialty. And then about 15 years ago, due to many reasons, I switched into public health. And I did a training at UMass Medical in Worcester in preventive medicine and public health. And I have since stayed on there as faculty. So I think it was during that training, I was taking environmental health, a course for my, the MPH, the Masters in Public Health. And, the discussion about air pollution and what direct impact that had on health. And they kind of talked about like a couple specific events, the London fog in the early 1950s. My mother grew up in London, so she certainly remembers it, where thousands of people died with, usually it's called an inversion, where the air kind of doesn't move, and there was high pollution rates. There was also one in Pennsylvania, Denora, a smaller one. So we learned about those kind of historic events, and with actually very direct impact on death rates. So anyway, fast forward, I've also been for the past 10 years involved in Massachusetts Medical Society. It's medical students and physicians, and we work on policy through committee work and through a House of Delegates. Policy that we pass in our medical society, which is the oldest in the country. And we pass society that the staff government relations uses when they're speaking at the legislation. So they work at the state house level on bills based on kind of what the society is passing as that we pass different resolutions. Anyway, so one of those passed was on educating the residents of Massachusetts about environmental health issues. And as chair of the committee on the environmental and occupational health, we were charged, our committee, to educate the residents of Massachusetts. So in that, we created this video that I'll show here.
It's hard to point at any one incident. That's a little bit pseudoscientific to say, well, these people here came to my emergency department today because of climate change.
Oh, sorry.
But the science is overwhelming. We have a big problem.
It's important enough for a bunch of doctors to get together and be on camera, which is not something that we do.
We have to address this, and the sooner the better. Climate change is here now and is impacting health now.
We think of climate change, and climate change seems like such a a pleasant word. It's a little bit of change. It sounds incremental. Maybe we'll have a little bit stronger hurricanes, but it's not that big a deal. But it is a big deal when you start looking at the data. The health impacts basically fall into 5 areas, and there are different ways of slicing and dicing these, but basically heat-related disorders, respiratory and allergic disorders, infectious diseases, injuries and other consequences of extreme weather events, and mental health issues related to all of them.
Air quality and impacts on health has been around for centuries. Once the Industrial Revolution started back in the early 1800s, there's been an increase in the amount of cardiopulmonary, so heart and lung disease, as well as asthma and allergies.
The National Academy of Sciences came out, so nonpartisan organization, great organization, came out with a report saying 107,000 Americans a year are dying from air pollution. We're not even talking about climate change yet. We're just talking about the pollution that will lead to the climate change.
There's kind of two sort of big areas. One is their particulate matter, and particulate matter is fine particles that you can't see, but that can dwell deep in the lung. And ozone as well is sort of another big thing that's triggering for folks with heart and lung disease.
As temperature rises, our pollutants in the air come down to the ground level. And ground level ozone is a big problem that people don't connect to temperature change, but something that affects the quality of air that we breathe. Reduced air quality affects all of us, but some people it affects more, especially kids. So studies have shown that kids actually, their lung function does not develop properly if they are exposed to high levels of ozone, high levels of other pollutants. That's something that's gonna affect that kid, obviously, for the rest of their life.
Yeah, asthma is very common. It's one of the most common problems in pediatrics, respiratory problems. So children, once they get through the newborn period and all of that, they're pretty healthy. They should just be bumping right along and having fun, and no child wants to ever stop playing or doing things they like to do. So they only slow down when something really hits them pretty hard.
There is a website, airnow.gov, where you can look at your, I think, zip code and look at your air quality. You do want to care about the air you're breathing because the amount of folks with asthma and allergies is pretty high. And they're going to sort of be triggered or not be able to kind of fully participate at school or work if they're not feeling well with this. And that's a fairly high percentage of the population.
So people who suffer from hay fever, and I have a little bit of myself, okay, but not very bad, but there are people who really have bad nasal congestion, sneezing, eyes watering, and that's already getting worse because plants are putting out more pollen with higher temperatures, and the pollen seasons are longer. In fact, there's some data to say that they're already 3 weeks longer.
So the Northeast is the area of the United States that is warming at a faster rate than any part of the country. So certainly heat's on my mind a lot more, you know, and so I'm asking, do you have an air conditioner? You know, if I know that there's heat coming up and that I have a patient with cardiovascular disease or diabetes, you know, on my mind a lot more is the safety of their home setting in the midst of a lot of these heat waves.
I encourage families to just really be prepared and aware of their surroundings. So if you're gonna be outside for a prolonged period of time with heat exposure, make sure you have access to different ways to hydrate, make sure you have a place to cool down, make sure you're taking breaks between long stretches of physical activity.
It's pretty clear that very hot weather, it's not good for most people. At Cambridge Hospital, for example, on hotter days, we're definitely going to see more emergency room admissions.
When the heat waves come through, they cause a rush of heart attacks and strokes. This is known. We will see more respiratory emergencies, more infectious diseases in Massachusetts as the temperature warms.
I think anybody who's trained in infectious diseases is uniquely aware of the fact that human illness, the illnesses that we deal with, are intimately related to what's happening in the world around us. Our specialty is unique because it is not one that deals just with the human. It deals also with the organism that causes an infection. And many times those organisms exist in the environment.
The two diseases that we're primarily concerned about here, although there can be others, of course, but in Massachusetts, we're concerned about Lyme disease being transmitted by ticks and West Nile virus and other viruses that can be transmitted by mosquitoes.
Their habitat is changing, and that in turn is going to affect us. So when we don't have a very cold winter, things like ticks and mosquitoes that normally go to ground in the winter don't necessarily. So they stay more active. So then they have a much longer breeding season. And then there's just more of them, and more of them that carry disease.
They're likely to be seen farther into the fall and earlier in the spring because of the warming climate. And so we've seen cases of Lyme disease, for example, in December. We've seen them early in the spring.
Their habitat has been spreading. They're moving further and further through the state.
So we are going to have to tell people to be much more careful about avoiding insects. If your kids are playing sports, it needs to be clear that you want to avoid mosquito bites.
We really got to expand the kind of diseases we're thinking about because climate change is changing the prevalence of some of those diseases in the area.
And all of these things, we look, of course, first at the direct effects in terms of pathophysiology, the effect of poor air quality, of higher concentration of pollen, allergens in the community, and how that disrupts my life physically. But the psychological effects, they're profound and they're evident to everybody who suffers.
One of the ways that we see mental health affected is through severe weather or because of severe weather. Severe weather we know is linked to climate change, and we can also link depression, anxiety, even PTSD to severe weather.
During a storm, both in the summer and the winter, there's injuries, there's death, and there's a lot of impact on mental health and stress. If you're impacted really in any way, even if as bad as if you're displaced and have to go somewhere else, it's extremely stressful.
You know, something I think a lot about is the psychological impact of feeling this threat. You know, we're a coastal state, and a lot of our communities are right on the coastline. And so you look at the maps of what different levels of warming could cause in terms of flooding, and that people will be impacted in this way and have to think about moving. Those are real threats.
We're sort of in the early stages of trying to get our collective minds around this, the kind of existential unease that accompanies the threat of this scale. But I think realistically, we have reason to try to respond to it now, even if we don't know all the answers.
I mean, my response to those feelings was one of, action and engagement and hope. And for me, it's been empowering. And I also recognize that I'm not going to be perfect, because we exist in a system, that is built in a certain way. We have roads, we have cars, we have coal-powered power plants. Like, some of that I can't change immediately. But I feel comfortable that I'm trying to live my life in a way that fits with my thinking about what's happening in the world. And then that leads me to feel empowered to be involved in my community.
So I think there's so many things that people can do in their own community. Taking public transportation if you can, instead of driving yourself in your car, or riding your bike or walking to work. It can be figuring out what you don't have in your community and what would be helpful, and then advocating for those things. Maybe getting a cooling center if they don't have one already, making sure that they do have one for those really hot days. Or making sure there are bike paths, making sure there are sidewalks that are safe for people to walk so that they don't have to drive.
Cities that have reduced pollution have seen health benefit. So this is a fixable problem. If I thought this was truly hopeless, I wouldn't bother. I'd go do other things. But it's not. It's actually a fixable problem. It's analogous to having high blood pressure or a tobacco abuse problem. You can fix those things.
Climate change is occurring. It's happening. And yes, it's something we hear on the news, but it's also something that is affecting our health and our ability to enjoy life. And we need to pay attention to it. it does affect us all. If not directly, then indirectly in a very powerful way. And there's a call for all of us to be involved in a solution going forward.
All right. I can pause right now, see if there was any questions on the video, and then I have a few slides. We'll also show you some more information and ways to get involved and talk a little bit about a couple things we're doing. No questions, it sounds like. So I'll pull up the slides, but feel free, like I said, if you have any comments or questions about that. The video, I think we made it a little over 2 years ago.
If anybody wants to type the questions in the chat, if they don't want to be recorded, I am happy to read them. So feel free to ask any questions in the chat box. Dr. Alker, do you feel like there's been significant progress made in the last 2 years since the video was made?
In the last 2 years, you mean, I guess in our understanding, where I think we're studying it more, not in that video and not in the slide I have, but being my background in OB/GYN, there's definitely, newer areas that this is being studied. And with the air pollution, there's definitely impacts on pregnancy, preterm birth, and low birth weight infants. So that's, it's expanding that way. In terms of, I don't know, community response or state response, I think, there's more people getting involved with this. And at the state level, we have a lot of physicians. One thing I want to say that in that video, I don't know if anyone knows Dr. Lou Faison. He was a longtime Southborough resident pediatrician. He's in the video, and he served on our Board of Health for many, many years. If anyone recognized him, but
he was an active library user.
Lou
so
Faison,
right? It was nice to see him on the video, actually. Yeah.
Exactly. We have, like I said, we have some, I think more and more, I'm from the medical community, so we have more and more, I think, physicians working on this. So getting the word out that way.
Has there been a significant increase in Lyme disease too?
Yeah. Mm-hmm.
Because I feel like there's notices
Definitely
every
on Lyme
summer.
disease.
Yeah, from what we hear from the Board of Health to watch out for ticks. And I think some statistical information has been included. And I've actually seen over the past couple of years, the numbers going up.
Right. No, that's been happening. I don't know, for like 10 years. That's like not something new, but the Lyme disease is definitely increasing. And unfortunately, there's some other tick-borne illnesses that unfortunately are going up as well. Babiosis, there's a couple others. And so now I think there's now 5 tick-borne illnesses. So not just Lyme disease, that's the big one, but there's others, unfortunately, that are coming up too. Okay, so like I said, I have a little bit more information, but really this is just time to ask any questions that you might have. I have the link to the video, which we already saw, and then I have a little summary slide that I think the CDC made. So you'll see that the slide is sort of a animated slide on that. And then I'm going to talk about resources and ways to learn more information. That's the video. This is our, the CDC slide. Yeah, and I took a picture of it so that would stop moving, but this was, I think, mostly summarized in the video, the vectors, and that's what mosquitoes and ticks are referred to, increased allergies, water quality with algal blooms are getting more common. We did in the video also touch upon kind of migration, mental health impacts, you know, if there is need to displace, heat-related illness, you know, folks certainly, especially folks who work outside, you know, direct heat exhaustion, but the heart and lung disease is really affected by the heat, as we mentioned in the video as well. So that's a summary. And like I mentioned, in the last couple of years, more and more areas are being studied. So I know about the, you know, prenatal impacts, because that's something that's also been coming out as well. Any questions on? The next slide I put together just is about a couple things to think about going forward with climate change and health and the health impacts, that there are more and more folks working on this. So we want to improve our data-driven response. We want to look at that data, and then we want to, you know, based on what we have for surveillance, we're going to like work more on, you know, tick-borne illness, because that's increasing and that's felt to be something that, you know, we can look on. So the other thing is increased surveillance for climate-related health conditions, and that's basically keeping the data. And I do think more folks are doing this, and get involved locally with actionable policies and legislation. So there are from time to time things in front of the state legislation that impact climate change. So I can show you some organizations that keep in touch with what's happening on a statewide level. One thing I think in the video they mentioned about cooling centers, if you didn't know, we do have cooling center here in Southborough. So we use our senior center as our cooling center on the hot days. Now, if anyone is interested, I think the Harvard School of Public Health has really an entire kind of division devoted to health impacts of climate change, the sea change, it's climate, health, and the global environment. And they have a whole division. And they have a newsletter called the Climate Optimist newsletter, which is super, super helpful. I subscribed to that a couple of years ago, and it really gives kind of interesting events to look out for. You know, last month, I think it gave interesting youth to follow on, well, I don't know if it was TikTok, but it was like, you know, interesting social media accounts to follow. And so it has a lot of ways to get involved and learn more about climate change and health. And then, so I would really like stress that if you want to do anything to sign up for that newsletter, that would be really, really helpful for you. A couple other things. CDC has information on climate and health, a dedicated page, and they do it by region. So they have a specific one to the Northeast. So that's helpful too, because it really will dive into the statistics sort of on a local level. The American Physicians has a climate change toolkit, and air pollution information. Again, I mentioned in the video and at the start that this is really an interest of mine with the air pollution. I mean, it has such direct effect on your health. It was really, like I said, really mind-boggling when I first learned about this in environmental health. And the airnow.gov website, we can look at by zip code, the air quality. And I think folks with lung disease, will notice it on poor air quality days, and you shouldn't be really out and exercising on those days. And then the Purple Air is the other website that I reference here, and that's in relationship to a grant in the state of Massachusetts put out about 6 months ago. So we applied as a town, Southborough. I led that with the Board of Health. We applied for a community grant to have air sensors, which measure particulate 2.5. So what Purple Air will host that information. So that website is up and running now, and you can look at air quality measurements, air sensor readings from all over the globe, actually. And the state, through the DEP, put out a call to cities and towns. And I think in the spring, we will get 5 air sensors into our town. And so we applied for the grant in collaboration with the schools. And we have, 5 different spots over town that will host the sensors and measure the air pollution. And so those will be discoverable on the map. I think 39 municipalities just got the grant awarded, and then are going to be get those air sensors up and running. So there'll be more measurements from Massachusetts. But like I said, it's actually a global thing where you can look at different air pollution measurements. And so, like I said, we're putting those in the spring and working with the school, perhaps with some curriculum around that with the air pollution. All right. There's no questions. I'll go to, I got another slide. One thing I can encourage, probably the most thing that I would encourage, is to sign up for the Sea Change newsletter, Climate Optimist, and just some things that are also affiliated through that center and that School of Public Health, and is available on their website. For example, different events. There is the Youth Climate Summit, which I believe is for teenagers. If folks have someone, I believe it's like a week-long program in the summer, basically like a summer camp for teens who would be interested in learning more about climate change and health. So the other event was sort of just a 1-hour event about talking about climate change. I work with, like I said, I work with physicians through Massachusetts Medical Society, and through them, I have other organizations. The Massachusetts Medical Society has put on events co-sponsored with the Greater Boston Physicians for Social Responsibility. That's all healthcare providers and really community members who are interested in the topic. But really right now, kind of the biggest topic that they're working on is climate change and health. So that's the Greater Boston Chapter of Physicians for Social Responsibility. And they, I think folks might have heard of that. They were founded maybe 40, 50 years ago, in terms of, they also initially worked on limiting nuclear weapons globally. And they're currently working, like I said, on that topic, as well as the climate change and health. So that organization is keeping abreast of ways to get involved with communities. The other group that has, I've heard a lot, is about the Elders Climate Action Group. It's a group, again, it has a big Facebook presence, and it's kind of founding, or the largest chapter is here in Massachusetts. So I list the website there if folks, it's a way, it's not a medical group, but it's really just for any citizens who are interested in working on climate change topics and learning more about that. So, and like I said, they have a good social media presence for that as well. I think that's probably the last slide. So I'll open it up again if anyone had any comments or questions.
I was actually going to ask you what we could do as like the next step, but that was literally your last slide. So
Right, we've got a lot of places. Yeah, if you do one thing, I would probably do the Climate Optimist newsletter. But right, thinking about Southborough, like I said, we are going to start that air pollution component with the air sensors. And I'm new here, but you know, I think probably as we go through with planning, just to think a little bit more. But I know the SOLF is in the trails. You know, I know the Trails Commission, right? They're working on some increasing some walkable areas in Southborough, right? Both of them. I mean, I've just been here a little while, but I've met folks from both of those or been in contact.
they
with
usually
both those
call it
two
SOLF.
organizations. SOLF,
Yes,
right?
SOLF for
SOLF.
short, but it's
Both.
for people who don't know, the
Both.
Southborough Open Land Foundation,
Yes.
and then the Trails Committee, and Catherine is the chair of that. She's great.
Yes.
So yeah.
Yes, I haven't met her, but she reached out to me on email about something. So, and the SOLF, right? They have really right. They showed me a map. They have a nice network of trails.
Yeah, we've done partnership programs with them in the past where they've done different, like we did a presentation with them that talked about beavers in Southborough, which you wouldn't think would be fascinating, but beavers can completely change the ecosystem. I learned a lot that night. So that's one of the things we've missed about not being able to do in-person programs is partnering with SOLF for like the annual event we usually do with them. So
Yep. At Heritage Day, right, they had a table, I think, near ours. So I did talk with them, and I've talked with them about some of the other things, and they're interested in this air pollution, air sensors, and going to work with us on that as well.
If people did want to follow up with the local elected officials, I met Carolyn Dykema a couple times. She's the representative in the legislature, and I know climate issues are important to her. So that would be something where, you know, I think if people wanted to follow up and talk to her about what's going on, that she could probably give an update. Yeah.
Right. What's going on at the state? Right. She's the House, right? The representative.
Yeah, and our state senator is James Eldridge.
Okay. Yeah. All right. All good tips. Anyone else with any comments? Can you check the chat, Ryan?
Yeah, we did have a comment in the chat. So Mariana said, I find the Climate Optimist a refreshing resource to know about. Thank you. I will sign up for it.
Yeah, it's enjoyable to read. How's that? And you know, just keeps it on the radar. You know, that's kind of going forward, keeping that on the radar. Yep.
Well, Dr. Elker, thank you. This was great information, and I learned a lot tonight. So thank you.
You're welcome. Yep. You know where to find me. Cordova Hall.
Thank you, everyone, for attending.